there are a number of things that we can do to tackle those comorbidities that seem to make bouts with COVID-19 so much worse. We're talking about high blood pressure and obesity and diabetes. So let's do a deeper dive on exactly what it is that you and I can do right now to help ourselves out. And for that, we turn to dietitian from the Barnard Medical Center, my friend Lee Crosby. Lee, welcome to the Exam Room Live.
Thanks for having me.
Hey, there you are. I appreciate you taking the time this afternoon. First of all, how are you doing? It's been a while since you've been on the show.
Yeah, it's been an interesting time, as I'm sure it has for everyone else. We actually had some family issues, so it has been a time, but I am so happy to be back on the show and getting things back to, I would say, new normal for now.
All right. Well, we appreciate you getting back to your new normal with us. So let's talk about ways that we can address obesity, hypertension, diabetes, all of those things, which are all especially important right now.
Yeah, so there has never been, and as Dr. Barner was saying, there has never been a more important time to make a diet change. If you've been thinking about it, now is the time. I mean, our number one goal when it comes to nutrition with this viral attack that we're under is to prevent, improve, or gosh, maybe even eliminate some of the conditions that put you at high risk if you do contract COVID. So like you said, diabetes, high blood pressure, high cholesterol. One of the things that these all have in common is that they damage blood vessels. And I just want to talk about that a little bit because it's so important in terms of what happens if you do catch this virus. So I'm sure know this, but we'll just go over it one more time, that blood vessels really are those highways, right? They are highways in your body that deliver oxygen, right? So again, we're just going to illustrate why diet is so important here. Your red blood cells, they are like trucks that are carrying oxygen all around your body, and the lungs, that's the supply depot where the trucks go to fill up. Are you with me here?
Keep going. You're the expert on this. School is in
Let's have
session.
story time.
I'm
All
just in
right.
the front row absorbing all the info.
So if everything is functioning right, your supply depot is good and it's got supplies and the highways are open, no issues. Now, if you don't take care of the highways, and this is what happens if, bad diet choices can lead to things like diabetes and high blood pressure and high cholesterol. Basically, those highways, your arteries are going to get rutted with potholes. There's going to be some lanes closed. But, as long as the trucks are getting enough supplies, they're still going to be able to get through and people are going to get enough to get by, right? Then let's say a tornado hits the supply depot, right? The supplies are decimated. There's hardly anyone around to load the trucks. Like, this is COVID in your lungs. There is a tornado hitting the supply depot, right? Now you got like half empty trucks. They're kind of like puttering out of the supply depot. Now, if the highways were wide open and smooth, they could probably still get everyone the supplies they need to get by. But if they're slowed by potholes and lane closures, like, your supplies aren't getting there in time. So to put this in the context of a viral pneumonia or COVID, like, if you are not able to get those blood cells, the red blood cells that load up with oxygen efficiently to your body, and your lungs aren't working well either, it's a bad situation. So this is just a really general, broad look at why it's so important to tackle these conditions, to make sure that, heaven forbid, if that COVID tornado does hit your lungs, that the rest of your body can help pick up the slack, and that those blood vessel highways are wide open to get that oxygen where it needs to go. Because the one thing we're seeing with this virus is that people's oxygen levels tank as their lungs start to struggle. So we want to make sure we're building up all that sort of reserve capacity. And the way do you do that is, come on, Chuck, healthy diet. That's right. Come on. That was a trick question.
I mean, I thought I knew the answer, but I wasn't going to hazard a guess and risk not looking smart, especially not on a Monday.
It's the mute button. It's the mute button delay, isn't it? I get that. The nice thing is that the same diet that appears to, I want to say, fill in the potholes and take care of your blood vessels and all the rest of you and help lower blood sugar, it's the same diet that seems to likely help in terms of immune function. So, and it's not just me as a dietitian plugging good nutrition. So there's actually a paper out of China from February of this year, COVID paper specifically, with the very exciting title. Actually, it is an exciting title: Potential Interventions for Novel Coronavirus in China, a Systematic Review. And they noted very specifically, it was actually one of the first things they talked about in the paper, that nutritional deficiencies could worsen these emerging viral infections. They went as far as to, and I'm quoting here, quote, verify nutritional status of COVID-19 infected patients before administration of general treatments, end quote. Now, I think that's a little much. I don't think we're going to grab a diet history or, do a micronutrient test on people when they walk in. But the point is that if someone is not sufficiently nourished, if they are even, just an insufficiency, not a full deficiency on some of these vitamins and minerals, that the immune system can't do what it needs to do to help the body recover. So they actually use the example of selenium, and not only selenium is an important antioxidant. We're getting it through our diets. You can get it if you have a Brazil nut every day. You've heard me talk about that. That'll knock it out. But what I found fascinating here, and this isn't COVID, this is a different virus, but is that not only is being deficient in selenium a problem in that your body doesn't fight, doesn't have the antioxidant power that it would, but it actually can alter the virus so that a virus that normally wouldn't cause as severe of a disease can become more virulent, so more harmful if the host doesn't have this antioxidant capacity, the host being the person. So it can actually change the virus and make the virus more aggressive, which I thought was pretty wild. So all of that is to say that the same nutrition recommendations that are going to help reduce the disease or improve the diseases that make COVID more dangerous are the same ones that are going to help your body fight COVID if you get it. So it's a virtuous cycle. There's so few of those in life,
I hear you. It just seems to me that it's really important that we kind of take care of ourselves as much as possible right now. I mean, the bottom line, Lee, is this, correct me if I'm wrong. This virus, this pandemic is still so new that we can't say for certain that one thing directly relates to the other. But what we do know is that through diet and lifestyle modifications, you can significantly improve the conditions that do make COVID-19 worse for so many people. We're still seeing cases of COVID-19 in young people, even deaths. But we do know that diet changes can improve blood pressure, hypertension, reverse diabetes, heart disease, all of those other things that the reporters mean when they say the patient had underlying conditions. That's correct, right?
Yes, that is absolutely correct. Yeah. So that's the thing. This is also new that we don't have any specifics on terms of nutrition for fighting this specific virus in this exact moment. But what we do have is very strong evidence suggesting that, hey, we can lessen, mitigate, in some cases, reverse the conditions that put you most at risk. This thing is actually on, right?
It is actually on, yes.
Okay, good. And just in terms of specifics, can I just jump in real quick? It's not going to be news, I don't think, to most of our regular listeners, but we're talking loading up on fruits, vegetables, whole grains, beans, up to an ounce, a small handful of nuts and seeds. Those are going to give you some of the omega-3 fats that are actually going to help lower sort of systemic inflammation or the friendly fire so that your reserves can, kick into gear when they need to. Taking a B12 supplement, a little bit of vitamin D if you don't get regular sun. None of this is COVID specific, but there's good evidence that it can help with the conditions that make it most dangerous and that it gives your immune system what it needs to fight the good fight.
All right. So a lot of people are now saying, well, Lee Crosby, you can talk the talk, but do you walk the walk? What are you eating during this COVID pandemic? What's on your plate? What's in your pantry?
As many fruits and vegetables as I can muster. So I know it's tough with the grocery store, but honestly, here's the thing. Everyone is stress baking right now. So the flour and the sugar and all that chocolate chips are sold out, and I'm actually fine with that. Also eggs, which I'm very, very happy about, but we can talk about that separately. But what you can still get is a lot of produce. It's kind of, I'm happy about it as a dietitian, yet I'm also a little sad because it means that people aren't buying it as much. But honestly, in terms of reversing these conditions that make COVID more dangerous, or at least improving them, and in terms of giving your body what it needs should you catch COVID, wow, that's what you want to eat. So I always start my day every day, unless there's been maybe 1 or 2 days I haven't been able to have fresh greens in the house because I'm not going to the grocery store nearly as often because hashtag healthy at home. But a breakfast salad every day. People look at me like I'm crazy, but I don't care if you're having breakfast salad or cooked greens or anything. Greens loaded up with potassium and magnesium to help lower blood pressure. And basically, also, there's some evidence that they can help heal, that they have substances that can help heal the lining of your blood vessels. So, filling in those potholes, kind of great. So, I have a breakfast salad and then oatmeal, right? That doesn't sound like a superfood, does it?
No, well, I mean, I think it's super tasty.
It is, it is super tasty, but it also is rich in zinc, which your immune system needs to function normally. And it's high in soluble fiber, again, to help lower that bad cholesterol, help heal up those blood vessels to get oxygen where it needs to go if, God forbid, you should catch this virus. So again, none of this is COVID specific, but that's what I'm eating for breakfast. I'm getting my greens, I'm getting my oats every morning.
Well, let me ask you this. You said, and I've had a similar experience in the stores that the fresh produce is more or less readily available.
Yeah.
Do you, I'm just going to throw this at you because you are the queen over at Veggie Quest. Do you have any tips for making fresh fruits, fresh vegetables last a little bit longer?
So I would keep them in all right. So your greens, you want to put them, you know how you have the drawers in the crisper drawers, right?
Indeed.
And a lot of them, people don't know this, but they have the little adjustment. There's like a humidity adjustment and it goes from fruit to vegetables. Make sure you do that little adjustment because it's going to give you the right amount of air circulation to keep your produce of each type fresher longer. And then the other thing is I sort of buy staggered things. So I buy, you can get those big old like pound tubs of spring mix now for like $4.99, which is not a bad deal. So you grab those and then you grab a thing of either a package of romaine hearts. Those things will last in your fridge like 2 or 3 weeks. Green or red cabbage. I guess red cabbage isn't technically a green, but green cabbage, that stuff will last in there if you don't peel it. I mean, you're probably not supposed to make it last for a month, but oftentimes it'll last for a month. So you can keep green things that you knock out the spring mix first, then you chop up your romaine hearts. And then when that gets low and you still can't get out, then you go to the green cabbage. So yeah, actually try and buy things that are really great fresh and then things that will stay fresh for weeks.
That's a really great tip. Those are actually really great tips, plural, especially as we're being told to limit the trips outside of the house, limit the trips
Absolutely.
to the grocery store
Yep.
as much as possible right now. Lee, we are in the home stretch of the show, but we can't go without putting on our investigator hats, get our crack staff on the case, take a deep look at these myths that are running wild on the internet. It's a segment that we call Health Boost or Health Bust. And today we are going to be taking a look at resveratrol. Lee, I know that you've seen this floating across the interwebs. What is the truth here? Is resveratrol a good thing that we should be ingesting right now in terms of fighting back against COVID-19?
Yeah, well, the answer here is it depends on how you're getting it. So resveratrol is a substance that's found in the skin of grapes, like particularly red and the darker grapes, the skin of peanuts and strawberries and blueberries. So all these things are super healthy. It's an antioxidant. It has some anti-inflammatory effects. And actually, there's a review article back in 2015, and it says that it can inhibit viral replication, right? It can keep viruses from making more viruses. How does it do that? It helps prevent viruses from making the proteins they need, from expressing their genes, like has benefits noted in influenza, respiratory syncytial virus, the chickenpox virus, Epstein-Barr virus, African swine fever virus. Wow, this sounds great, right? Like, let's run get our resveratrol supplements. And this is one that I actually just came across last night. There was a study done for resveratrol and the MERS coronavirus back in 2017, and it examined the effects of resveratrol on that MERS coronavirus, which again, close cousin of the current SARS coronavirus, the SARS-2 coronavirus. And they found that resveratrol basically helped block the infection, helped protect cells from getting infected, lung cells, and helped them survive longer after they had an infection. And it made it harder for the virus to multiply. It made it harder for the virus to make more of its little capsid proteins, which sounds great, right? Like, yes, let's go take this, except it was done in cells, in monkey kidney cells. So that's not really going to tell us what can happen in people. But People are taking all these findings from like Petri dishes and sometimes from animal studies. And they're saying, great, let's go do this. We have no idea if this translates to real life when it comes to viruses or immune function. The only actual human like clinical trial that I could find that didn't even look at viruses, it just looked at immune function, was this teeny tiny study, 9 healthy volunteers. This is a study out of Japan, young, median age 36, BMI was 20. So this does not look like most of America, but they gave people 1,000 milligrams of resveratrol a day for about a month. And they looked at the effects on the immune cells that circulate in the body. But I mean, we're talking 5 people got the resveratrol and 4 people were controls. And not only did they weren't even good controls, they didn't get a placebo. They just didn't get anything. So we had 5 people taking resveratrol and 4 people just hanging out and doing what they normally do. And what they found was intriguing. So resveratrol was associated with an increase in the numbers of these circulating gamma delta T cells and also regulatory T cells. Those gamma delta cells are important because they actually do help with viral infection. But so yeah, this was a clinical trial and it didn't seem to have any conflicts of interest because I went through and looked and it looked like it was all sort of governmental universities, but we're tiny sample. You don't get, I've actually never seen a study this small. The control group didn't have a placebo and we all know the placebo effect is powerful. Like these could have been due to the placebo effect from taking any pill. And even the authors say that this was hypothesis generating. So not something you should even think about in terms of going out and doing it. And it didn't look at COVID-19 or the SARS coronavirus. Like this is not, it's a related virus, but it's not even a related virus. This study, they were just looking at the effects on the immune system. So the only clinical trial that I was able to find on resveratrol, the only thing that was done in people was tiny and it wasn't even looking at viral infections at all. But what I did find was a paper, a big review paper that looked at resveratrol, wait for it, in whole grapes. And their conclusion was that for people who are healthy or looking for preventive effects, and again, this is a slightly older, I think this was a 2017 paper. Don't quote me on that. They were saying, making the excellent point, as I'm sure has come up on this show many times, that grapes are a lot more than just this one little isolated chemical structure. They also contain catechins and anthocyanins and polyphenols and all these just, and flavonols that all together probably have a synergistic effect that's much more than just taking resveratrol in a pill. So in terms of, is this, a good thing or a bad thing? Is this a health boost or a health bust? I'm going to go thumbs up, health boost. If you're getting your resveratrol from whole grapes, berries, and peanuts with the skins, good job. I'm going to go with health bust on the supplements, unless they're somehow prescribed in a clinical trial for people in the hospital, because we just don't have data suggesting that this is going to have make a difference in someone who's sitting at home worried about getting it. It is, however, going to cost them money. And so many supplements, we just don't know if they even contain what they say they have, if they have any contaminants. So again, thumbs up from Whole Foods. The jury is still out on whether the supplements are helpful.
Well, I'm getting a question in my ear from our producer, Laura Anderson. She says that a lot of people are writing in wondering not just about resveratrol, but about vitamin C. They're curious, should they be taking a vitamin C supplement now to boost their immune system, or is it still better to get it from a whole food?
So if you are... Here's the thing with vitamin C. So there's been a lot of data over decades really on vitamin C. My general approach is to be eating lots of vitamin C rich foods. So on that day of foods, like what a dietitian's eating, I'm eating lunch. I had tomatoes and oranges. Oranges are great because if you can get a hold of them, they keep for a super long time. Also, weirdly, kiwis, very high in vitamin C, and they keep in the fridge for weeks. So there's a fun little random pro tip. If you are not yet sick, make sure you're eating lots of vitamin C rich fruits and vegetables, because there's no data showing that in people who are already getting enough vitamin C, well, there's not the sort of consensus data is that if you're getting enough vitamin C, adding extra on top of it is unlikely to help in much way of any if you're healthy. However, if you are sort of in that marginally deficient category or insufficient, it can make a big difference. They actually did a review, and this was back in 1999, but there were 3 of the studies that they reviewed on vitamin C supplementation in pneumonia. Interesting. And they each of those studies found a reduction in at least 80% in the incidence of pneumonia in the group that was getting a vitamin C supplement. But the groups getting supplemented in vitamin C, in 2 of them, their vitamin C intake was low to start. So really taking a supplement was just getting them up to sort of normal running level. And then the third group was actually in military recruits. So they were under massive physical exertional stress when their body would be needing an additional antioxidant boost. So the sort of take home here is that vitamin C is relatively safe. It's probably unlikely to hurt. If you take too much, you might get some diarrhea and some other not as fun symptoms. My general recommendation is to have people eating lots of vitamin C rich produce, because again, you're not just getting vitamin C, you're getting all these other things that can help keep your body strong and healthy. And then, if someone actually gets it, you might consider a supplement, but again, we just don't really have data on that. So to keep pushing those vitamin C rich foods to get all the good stuff that comes with them. But yeah, it's the science is still evolving when it comes to vitamin C and immune health.
All right, Lee Crosby with the knowledge. I appreciate that. And for the viewers at home, you really don't get a chance to see a whole heck of a lot behind the scenes, but I will tell you that Lee was up past 3 o'clock in the morning last night working on notes for today's show. And so, Lee, I just wanted to take the time publicly to express my gratitude to you, because that is so far above and beyond expectation. It's not even funny. Thank you.
Thanks.
So very
I
much.
covered up the dark circles, right? Huh?
You did. Fantastic. Fantastic.
It was my pleasure, and actually really interesting, just fascinating reading out there. And again, I do recommend that people keep tuning into the podcast, because we have so many different experts coming on. I've been listening to it because it's so much great information. So thank you for all you're doing to keep everyone informed and healthy.
Well, we appreciate that. And be sure to tune in this week on the audio version of the podcast. I'm going to be sitting down with Dr. John Pippin. Lee, you were talking about human clinical trials, just a limited sample. Well, they're working on a COVID-19 vaccine. Human clinical trials are underway out in Washington. I'm going to talk about that with Dr. John Pippin. This was a fascinating conversation. Is this the right way to not only speed up bringing vaccines and drugs to market, but also eliminating animal testing altogether? What he had to say about the current system in place and how irrelevant so much of the findings that we get from animal testing are. They so rarely translate to human results. So by going straight to human clinical trials, we're speeding up the process and we're ending animal testing. And if successful, developing the COVID-19 vaccine in this method, what does that say for the future of all drug development? That's going to be on the audio version of the podcast this week. So make sure that you head over to Apple Podcast or Spotify or Stitcher. Look for the Exam Room by the Physicians Committee and mash that subscribe button. And if you would be so kind, also leave a 5-star review and a nice comment. And we would appreciate that so very much. And Lee Crosby, once again, thank you so very much for taking the time to join us today.
Thanks for having me on the show, Chuck.
And for everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thank you so very much for watching, and stay safe.